We want to take you now to an update on the measles outbreak in Rockland County, New York. Right now, county officials are holding a press conference to discuss the latest on the effects of the state of emergency that was declared earlier this week. Let's listen in.
500 since we declared the state of emergency just a couple of days ago. While these numbers are the most recent provided by the state, we must understand that it may not encompass a total because they have about 14 days, doctors do, to enter this information into the database. But the numbers in the system are, so the total is probably much, much higher. We have heard anecdotally that the declaration is having an effect. We have heard of crowded doctors' offices and pediatricians as parents. Not only is a positive response locally, but nationally and internationally to our declaration. Public health experts agree that this was the next logical step to deal with this outbreak. I want to point out where we are here in Rockland County and why we're ahead of the curve here. Other localities in Brooklyn, for example, just reported 31 new measles cases this past week. 31 in a week. This is not going to happen here in Rockland County. The reason why we took action here in Rockland, because it became very apparent that the trajectory of success was starting to alter, that our investigators who were trying to simply find out what the movements were of infected individuals so we can warn others about the potential compromising of their health if they were out at the same place and time, was being compromised, where we were being told they don't want to speak to us. On top of that, we have the holidays coming up of Easter and Passover. It was not lost upon anybody who's been involved in this that when this outbreak started, it started with 7 unvaccinated and infected individuals coming over here for the Jewish holidays, settling mostly in and around our Orthodox areas, and doing what families do, enjoying each other, seeing each other, spending time with each other, engaging each other. That created a petri dish of sorts where obviously this disease took off. And the health department's been battling this ever since that time. We looked at our approach as being well-timed because the trajectory that I mentioned, that the increasing pockets of resistance we were getting, the coming of the holidays, and after conferral with our health department, we essentially went out and told people if they get that first shot of the 2 that they need to get, that would qualify them to be exempt from the ban of being in places of assembly. The goal here is to get as many people immunized as possible. We want people to enjoy the upcoming holidays in both the Christian and Jewish faith. And there's opportunity here. So with that, I don't know what else we can offer here. The religious exemptions. I want to clarify something. There was an interview done up in Elmira, New York, where the rabbi made it very clear, and this is not surprising to us, but some simply do not believe it. There are no religious exemptions in the Jewish faith. There are no religious exemptions in the Catholic faith. Those are the 2 I can talk to. There are some smaller sects that do have objections religiously, and we have found that there is room for improvement in the school system. Just some of the cursory commentary made by parents who were interviewed for the local newspaper, Lohud, for example, revealed very clearly that parents were not having their children vaccinated, and it was not because of medical or religious reasons, because they just didn't want to, they wanted to wait, they didn't think it was appropriate. That is not the reason why you should avoid vaccinations. And the onus of that falls on the schools. So I'm asking the schools, I've read the state education law, I'm asking the schools to revisit their efforts in that area to ensure they are complying with the law. There are sections in the law that call for them to revisit the initial objections that were raised, the initial exemptions that were raised. Make sure that the exemptions that you're applying are truly appropriate. One of the things we did exempt in this ban for obvious reasons, because it was the right thing to do. If you have a medical exemption, clearly you're not going to be affected by the ban that was the emergency declaration that we declared here in Rockland. We're not here to get in the way of families and their doctor. But we are here to understand for sure that we are not going to allow measles or communicable diseases infect our population, compromise the health of infants, of pregnant women, of autoimmune system challenged people, cancer patients and the such. That is not what we'll be doing here. There are laws here in the county and the state. We expect them to be abided by, no more than that. With that, I will turn over to Dr. Rupert for her statements on her perspective on the matter. Thank you very much. Yeah, Patty.
Thank you. Good morning, everyone. What I want to do today is update you. We have at this point 157 cases. We have added a couple this week, and it seems like every day, one or two more. We also do have, unfortunately, from the last few cases that we have confirmed, some public exposures once again. So I will list them for you. We had an Uber that traveled from Muncie Hub Shopping Plaza in Muncie on Wednesday, March 20th from 1:20 p.m. to 3:30 p.m. The Nyack taxi that initially traveled from the Muncie Hub Shopping Plaza in Muncie on Wednesday, March 20th from 2 o'clock to 2:10 p.m. with a risk of exposure then for 2 more hours, 2 hours after the person was there, so till 4:10 p.m. The next is Rockland Kosher Supermarket located at 27 Orchard Street in Muncie, and that was on Sunday, March 24th from 1 p.m. till 5 p.m. The last is La Familia Taxi that initially traveled from the Rockland Kosher Supermarket in Muncie. That was between 3 o'clock and 3:05 with a risk of exposure until 5:05 p.m. So the times that I'm giving you do indicate the concerning times for those who might have been in those locations, in those taxis, and then could have been exposed to the measles if they are not immune to the disease. I take some questions if you have them. Otherwise, I think we've discussed enough this week that I don't really have any further updates myself. Though, if you have a minute, I'll be happy to talk with you about vaccinations. I was reading something last night that you might be interested in. I know you sometimes look for another angle on this. And one thing that a couple of things that I read was that every minute, 5 people are saved because of vaccines. And we're talking worldwide, not just Rockland County, but we're part of the world. The other is that the cost effectiveness of vaccines for direct costs is savings of $14 per vaccine given. And this is not just measles, this is all vaccines. And there's another $10 in indirect costs, social costs. So it's expensive. Not only do we want people to be healthy, but the cost to society is great. And 35 million people have been prevented from having the measles by the vaccines over all of the years. That's from when the program first began. So just thinking of those numbers and how it pertains to Rockland County is significant. Again, I'll take questions if you have, or Mr. Day.
Actually, before we start with the questions, I would like the commissioner, I believe the number was 2.6 million died in 1963 when the measles vaccine first came out. It's now 5% of that, and this is worldwide, because of the vaccine. I keep hearing measles is just a kid, it's no big deal, it's simply a childhood disease, it's just a fever. Oh, I'm sorry, I'm gonna move over. That measles is not a big deal. It is simply, it's a childhood disease, a fever, a cold. It's not a big deal. I would like the commissioner, if she would, because she's a lot more learned than I am in this, I could generalize. I would like for everybody to hear again exactly what the measles is all about. And it is not about measles parties or no big deal. I would like the commissioner to detail some of the things that happen to people who contract the measles both immediately, over a short period of time, and down the road when they get older. Doctor?
Sure. I know you've heard it before, but it's always good to repeat these important facts. So as Mr. Day has stated, measles is not just a red rash with a fever. There are complications. And years ago, people didn't know what the complications were. They just thought you got the measles and the kid got better, and maybe his brother or sister got the measles or their friends. What we've learned over the years is that there are many complications, and leading to death is part of it. But the most common would be dehydration, diarrhea, pneumonia. Think of that. The most common cause of death is pneumonia. Then we go to things like encephalitis. That's a swelling of the brain. And that's something that we have acutely that can occur, and then of course long term. You can see blindness, you can see deafness, you can see hearing deficits and visual deficits, even if it doesn't lead to both blindness and or deafness. There's an entity called subacute sclerosing panencephalitis, which is rare. If it happens to your child or mine, it would be 100%. And what that is a horrible, horrible complication of the measles that can occur from months to 27 years later, most commonly 7 to 10 years after an infection. And what that does is that causes involuntary movements, seizures, coma, and we can lead to death, and usually is fatal in those children. Years ago, they didn't realize, because of the time lag, that this was related to having a measles case. So we know that now, and those are the complications that we can see. The other thing that we can see is preterm births. We can see stillbirths. And we actually did see a preterm birth from a pregnant woman in our community in Rockland County who had the measles during her pregnancy. She did deliver early, as can occur. She did deliver a baby with the measles. This is what we don't want to see. As a reminder, too, with our vaccine, it's a 3-in-1. So not only does it protect against the measles, but it protects against mumps and rubella. And back to congenital measles, we can also see, and that's a horrible situation as well, congenital rubella. So this 3-in-1 vaccine's a bargain, and it works quickly. We give it to people who have been exposed to the measles. We can give it within 3 days of exposure. So if you've been exposed to the measles and you're not immune, we give that, and it will work faster than the incubation period of the disease. Phenomenal. Where do you see that? Where do you see a virus that doesn't mutate? It has not mutated, thankfully. So our vaccines are good. In fact, they're great. One is 93% effective, which is good, but since it's not enough. 97% is what we have with the second. So we all really should have our 2 MMRs. Herd immunity, I'll just mention that as well, because we're talking about percentages. We look for 95% of the population to be immune, so that if the disease does enter that population, it really has much less of a chance of spreading. Nothing's 100%. But I will tell you, the people that we've seen with the disease, they have either no immunity, which is the most part. Some have partial immunity, 1 MMR, or they'll tell us we don't know our status, which to me means they don't have immunity. And the numbers pan out, even with our 157 cases to date, that 3.9% of people who have had 2 MMRs have gotten the measles. That's exactly what we would expect. So measles is a serious disease fraught with complications. And I appreciate that all of you are interested in this so that we can help prevent this going forward.
Thank you.
Sure.
Okay, ask your questions. You have the floor.
You mentioned that the exposure at the kosher supermarket was 4 hours. Is that an employee?
I don't think so. No, I don't think it was an employee. No. No. I think the person was there between 1 and 3, but we had the 2 hours on, so it was not an employee.
Are there specific outreach efforts going on to the Orthodox Jewish community in the county? Because it seems like, in talking to the parents that we're talking to that object to this emergency declaration, it's predominantly Orthodox Jewish people.
I don't agree to that.
Well, this pertains to the whole county.
I know that pertains to the whole county, but it seems like the issue is, as far as people not following the order or getting the MMR that we're running into, or you mentioned a kosher or establishment, for example, are there specific outreach efforts is what I'm asking?
First of all, we've had an excellent cooperation from the community. Okay? Our epicenter has been the Muncie Spring Valley New Square area for 6 months now. It's not the only place we've seen cases. That's the most cases. We've had excellent cooperation. Having said that, we have had and provided community efforts for outreach all these months, and we continue to do so. We have met with the rabbis. We've met with the school administrators, the principals, EMTs, school nurses, pediatricians, family doctors, parents groups. If you have any other ideas, I'm happy to hear them. And they do continue.
On the exposures,
Marcus?
is it that someone then comes down they become symptomatic and then you trace back their movements, or these are people with it or willingly going out?
Well, I think that's 2 things, but
But what is when you identify that exposure, is it because of someone has come down sick after the fact, or was it that someone who had been sick was
both.
out and about?
Both. So I guess it really is 2 things. So we have been able to confirm 157 cases. There's a great deal more from what we hear in the community. Not all cases obviously have been reported, which is unfortunate, because the more we know about, the more we can go back and trace and see where they were, who they possibly exposed, who we can make a difference with before they would come down with the measles. As I mentioned, the MMR vaccine, we can give that within 3 days if they know that a person was exposed and needs it. We can give immunoglobulin, which is a passive immunity, not active like the vaccine, passive immunity up to 6 days after exposure. But if we don't know about it, we can't do that. That's how we could help to control this even faster, the more we know. We had more cases earlier on that were identified and reported to us, and we gave a lot of what we call PEP, post-exposure prophylaxis, during that time. And we still do as we know about cases. Yes, some cases we learn about later on, and it's past the post-exposure prophylaxis window.
What about with this cooperation with the state health
arrests
department?
or fines issued?
I'm sorry?
What's been the involvement of the state health department with this? Are they actively in the community monitoring what's going on? Are you having ongoing communication with them? Are they here? Are they? What's been that connection?
They have been here with us, on site at the health department, in the community. They have sent their staff down, they have sent physicians to us, directors of their departments have come down. We still have staff from the metropolitan region who are in our office right now, who were there this morning when I was there. What they do is they have helped us in many, many ways. They've been wonderful support, sending people out into the community, literally going to see patients who have the measles, drawing their blood, doing a nasopharyngeal swab, the swab in the back of the nose, seeing them and clinically diagnosing. They've come to us to the community outreach groups. Dr. Zucker, our Commissioner of Health of the state, has been with me to meet the rabbis and the school administrators, and we've met with the doctors and EMTs and nurses I mentioned to you before, on site. Also, we've had incident management calls all along since October. We were on calls twice a day initially, including the weekends, then daily, then it's tapered down to now it's once a week. They have been a partner in this, and good guidance, not even just a partner, but providing very good guidance. So we've been very grateful for that.
You said it was unlikely for any.
All right, we've been listening to Rockland County Executive Ed Day, and as you see there, Health Commissioner Dr. Patricia Rupert giving us an update on the measles state of emergency in Rockland County, telling reporters there are currently 157 measles cases in the county. Now, earlier this week, the county declared a month-long state of emergency prohibiting unvaccinated children from visiting public places. And they say since this state of emergency was declared, it has led to crowded doctors' offices with people getting immunized. So they say it appears that the declaration has been having a positive response in the community. The measles epidemic has so far been concentrated in the county's Orthodox Jewish community, where many are opposed to vaccinations. The county executive said that they timed the declaration of the state of emergency with the upcoming Jewish and Christian holidays, hoping to prevent the spread of illness with large crowds gathering for the holidays. County officials continuing to urge people to get vaccinated to prevent themselves and others from getting sick.